Advanced care planning helps you prepare for your future health care at any age of your life by thinking about what matters to you and sharing it with your family, loved ones, and healthcare providers. It's also about deciding who will speak for you if you can't speak for yourself.
It's really important, for individuals who want to plan on how they would like to be cared for, whether it's in the hospital or at home or in nature, to to plan that with other people so that it's not a mystery and it isn't a crisis and it becomes a beautiful ceremony because life itself is a ceremony. Death is a ceremony.
My name is Lubin. I knew I was sick, but I didn't know I was that sick. I didn't know I was that ill. And I was like, how did this happen? I'm somebody who always takes care of herself. I take care of myself very well. And so that's all it was. They just kept trying to get the fluid out of my lungs. And I knew it was a hard conversation to have with my mom and probably my husband, but I just said, I'm not going to be intubated. There was something in my heart that I knew that if I was, I would have been there way longer. I didn't have a plan. I didn't tell people in the sense, there's always like small talk about it, like what you want to do when you pass, but I never had anything written or in place. And so for me, it got real fast. And even still today, it's a big healing journey for me and my family.
My name is Joanne Gould, and my traditional name is Lubin. I have an advanced care plan, and she is my decision maker. She's the one that's gonna, when it comes to anything happens to me, she'll be the one to make those decisions. I had that already. I never ever thought that I would have the responsibility of doing that. I gave her birth. I brought her up the best I could, but I never thought I'd have to make a life decision. And it was one of the hardest things I ever had to do because she says, Mom, I don't want to be on a life support. And I said, you don't have to, you'll fight this. You have the strength, the courage. We're guided by our ancestors, and not everyone has that opportunity to be brought up in a cultural way to believe in our spirit world. And we never know when the Creator's going to call us home or what our final journey is. And especially as a mother, to make those decisions for your child is really difficult. Loved ones understand that the final journey as a sacred process, and that with advanced care of letting them know what our final wishes are so that they can handle the impacts with grace and dignity, and that it will bring you as an individual peace, knowing that the family's not carrying your burden and that your wishes are going to be followed through. Taking advanced care steps to be involved with your own decision process, and more importantly, to bring honor and sacredness to your final journey.
I want to normalize the conversation about it. I want to be like, it's going to happen, and I know it's really hard to talk about. But the experiences that we've been through, it's really super important for people to talk about what they want.
Hi, my name is Dr. Kelsey Louie, and I'm from the Tla'amen First Nation. I'm a family physician, and I work within the hospital here in the Victoria area, supporting the psychiatry unit, including the geriatric psychiatry unit, where many individuals present to hospital sometimes those with advanced dementia and the inability to make decisions for themselves. We know sort of unexpectedly life events come up, whether it's through injury, maybe a medical event. They may be requiring a breathing machine to help support life. They may just become delirious and not quite thinking straight. And in those moments, it falls to family members or the substitute decision maker to help make that decision on their behalf.
I was privileged to be at my sister's death, knowing that she made a plan for her death and what her wishes were before she passed away. She told me who she wanted to be present during her care, and also when she passed away, that she wanted to donate her organs. So we went through all of what was mentioned in our conversation together, and what would happen. And then when we were all in agreement with her wishes, then we called in other people to share with the healthcare staff. And then when the time actually came that I was able to follow through on her wishes, the transplant unit came from Vancouver. This was in Kamloops. So when the transplant came to harvest her organs, it was so beautiful. They were so amazing, gentle, and kind. We were able to provide a ceremony before we let her go. We used a fan because a fan doesn't use smoke, but the purpose is the same, that we blessed her body and her spirit before she was gone.
So we recognize through our work with the First Nations Health Authority that this has become a really important topic of conversation that has surfaced within communities. It's been highlighted by our nurses who work with our community members, the health directors, and the leadership in communities. And just from hearing personal stories of family members who have been faced with difficult decisions on behalf of loved ones when they don't have the ability to make that decision for themselves. When it comes to the process of advanced care planning, this is something that families will often encounter when they enter the hospital system. If patients are admitted or requiring hospitalization, it's often something that the healthcare team will approach the individual about and or their families if that individual is unable to make a decision for themselves. As Indigenous people, when it comes to cultural safety and humility, we want our rights and our voices to be heard and respected. For the care team, when we encounter somebody who doesn't have the ability to communicate this, it becomes really important that advanced care directives or some planning that's done ahead of time be established to help guide the care team so that they can follow what your wishes would be. If we're able to have these conversations earlier in life before these big events happen, it becomes very valuable to the care team, but also to family, to help support what it is that loved one would want to have happen.
Life is sacred, and tomorrow's not guaranteed to anybody. And honor yourself by to be able to honor your family. It's really important.